All right, good day, my beautiful people. This episode is going to be a answer to a bunch of questions that we've gotten over the past couple of months on cryotherapy. So this is going to be kind of this all-encompassing, what does cryotherapy do? How does it work? What things does it actually affect? What thing does it not affect? And how does it kind of do all of those things inside of your body? So this is what you've been all waiting for. This is what you've all been waiting for. So we're going to dive into all things cryotherapy. I know. Thank you. All right, so let's get into it. We're going to go through everything cryotherapy related today. How does it improve inflammation? That's the big thing that everyone talks about. How does it actually work on your immune system? I'm going to teach you what happens whenever your body gets really cold and has to adapt to that temperature. How does it affect body weight and body composition and metabolism? There's been a lot of talk about using cryotherapy to improve body composition, so we'll dive into it. Is it bad for your heart? We've gotten a bunch of these questions. Can it actually help with pain relief? Do we have data on that at all? And can it help with healing problems? What does it do for stem cells? What does it do for athletic performance? We're going to go through all of that stuff today and much more, I have no doubt. So let's dive into it. So the first thing that you have to understand whenever we get cold, whenever our body temperature drops about 4 degrees, what happens is your body releases norepinephrine. That's its protection response to cold. This comes from a bunch of different areas, but this is a hormone and a neurotransmitter that's involved in focus, attention, mood. Norepinephrine is basically like your adrenaline. When you get that adrenaline and people are in that like hyper aware and they don't really feel things. You see this in athletes. They really kind of tap into that. They don't know that something's going on until after a game. That's because norepinephrine. Their body realizes that what they're focused on is more important than signals from the body, and so it blocks a lot of those things out. And it turns out that this is a really important part of the benefits of cryotherapy because we get this massive dump of norepinephrine, and that increases vasoconstriction. So your blood vessels start to compress in your extremities so that it can save all the vital organs, so that it can make you healthy and keep your heart and your organs all alive. If you lose a few fingers, your body's like, not a big deal. Doesn't affect our survival, but we're going to save all of these vital organs. So whenever you get into a cryotherapy chamber, let's talk about that for a moment. You get in there and your body releases this norepinephrine to try and save all of these vital organs. That norepinephrine starts to create all these cascading effects that go down into different areas of the body. That can be brain, that can be body, that can be organs, nerves, muscles, tissues, and we really start to see the benefits kind of filter into all the different areas of your health because of that. And if we do this correctly, then what we will notice is that there is very little downside to this short-term stressor. So you get in there and it is a stressor on your body, and we'll get into that in a little bit about how does that stressor create benefits, and could there be some times where that stressor is too much. But during that pathway, when we get norepinephrine released, we also see something else that gets released by your body. So we'll go through the science of what's happening first in your body. So there's a cold shock protein, which is a protein that your body releases in response to getting very cold. This specific one is RNA binding motif 3. So RBM3 is what we call it. And this is a really important one because when it gets released in response to cold, RBM3 plays a very, very important role into repairing the nerves and repairing synapses in the nerves. And what we notice is that because your body thinks that nerves have been damaged during the cold, it's so cold that these synapses break, so to speak, that we can actually start to notice that if we get a bunch of RBM3 released, your body thinks it's going in and repairing these nerves. And that creates this massive healing response in the brain, in the whole nervous system, to actually repair all of these synapses, some of which were not damaged and some of which were not damaged in the cold, but were damaged before. So we improve the function of all of these nerves dramatically over the long term if we're consistently doing cold exposure. And this leads us into a lot of exciting territory with nerve healing, which we've used it for in our office, but also in terms of Alzheimer's, dementia, other progressive nerve issues, where we can potentially create a healing response in the nervous system just by getting people cold on top of whatever other treatments we're doing. So that's in essence kind of what's happening. Your body gets cold. It has to figure out how to survive. So it releases all of these different hormones and neurotransmitters to keep you alive. And then we get all these downstream effects from those things. And we're going to get into exactly what those are. But a lot of the benefits and effects of cryotherapy have been anecdotal, where people are doing it. And I don't think you can separate the mental aspect from the physical aspect of cryotherapy, because there have been so many people out there who talk about the stress relief, the mental focus, the clarity, the anxiety removal. And I think that's for a lot of reasons, but you can actually dig into some of the research of it, of what's happening whenever we get in there. One part is that you actually cannot, or it's really difficult for you to be ruminating or be thinking about these other issues whenever you are in cryotherapy. You are very, very present in that moment. And you're present in a very interesting way. You are actually getting, a very hyper focus and almost skipping to that flow state that people talk about while you're kind of in this present moment. And then you come out of cryotherapy and you feel very invigorated. You've got a lot of these hormones and neurotransmitters floating around, and you feel very accomplished. You've done something very good that's difficult, that most people will not want to go through. All of those things are good for our mental health. All of those things help us to overcome challenges and actually teach our body that we can overcome hard things physically and mentally. And that's what's happening whenever we get into a cold exposure state. We're getting a physical insult to the body, and we're getting a mental insult, because in most of these situations, you could just get out. If you're in a cold plunge or a cryo chamber, you can just open the door. So to have that mental fortitude to tough it out, to keep those breaths coming in and just hold on until that session is over, that 3.5 minutes, if you will, is such a mental accomplishment that I think that part gives a lot of people a very good kind of focus that they can overcome these challenges. And in fact, when we were switching over, so we in our office use a true full body cryo chamber. So you actually step in, you're breathing in the cold air, it's getting all the head and the neck. And that's much better in my eyes, because there's so many tempororeceptors throughout the head and the neck, where in the chambers where your head's out, or a cold plunge where your head's out, we're not tapping into a good bit of these temperature receptors that really affect the release, especially around the head and the neck and in the brain. So when you get in there, when we were switching over to it, we had quite a few people who said they noticed, we had a few months where we were switching from the old chamber to the new chamber, that they noticed a change in their mental health, in their mental state, and they felt much better when they were doing cryotherapy. They had gotten off of a lot of these medications. So I think that's not to be overlooked. If that's the only thing we got out of doing cryotherapy besides everything else we talk about on this podcast, I think that would be a huge, huge benefit, that we have this way that is proven to improve our ability to handle stress, depression, and anxiety. And there's been multiple studies that have gone through the stress response, how it is improved by cryotherapy. And so, that's a big part of, I think, why we want people doing this. But let's get into some of the more physical things. So the first thing that we talk about is inflammation with our patients and with the kind of general public. If we can keep inflammation down, then a lot of the long-term and chronic problems can be improved dramatically. We've seen patients who we test inflammation by testing C-reactive protein. And so for a lot of our patients, if C-reactive protein is high, we want them doing a round of cryotherapy. We've seen patients come back where they were in like the 10x higher than we would want them to be in their C-reactive protein scores. And after a 3-month course of cryotherapy, they were down to about 2x higher than we'd want them to be. And this is after high doses of steroids, NSAIDs, anti-inflammatory medications did not work. So it has a real effect by changing the inflammatory pathway. The interesting caveat right here is that we don't often want to block the inflammatory pathway. We want to improve the body's ability to handle inflammation. We don't want to block inflammation because inflammation is your body's natural healing response. If we stop that, your body's not going to heal. And so we just want to improve your body's ability to handle inflammation and respond to it in a healing, healthy manner, and not just completely block it. And I think that's a really good thing about cryotherapy versus some of these other anti-inflammatory medications. So whenever norepinephrine gets released in a cryo chamber, something called TNF alpha, tumor necrosis factor alpha, is decreased in response to norepinephrine. And that is a potent inflammatory molecule. It's been implicated in almost all diseases of people having high TNF alpha. That's, you look at diabetes, heart disease, cancers, you look at irritable bowel syndrome, all of these things we find TNF alpha is elevated. And in humans, doing an interesting study came out recently, said that you need about 11 minutes of cold exposure per week to make a significant dent in a lot of the health benefits, but certainly an inflammatory state we need to hit 11 minutes to change our inflammatory markers. So that gives us a very real goal for most people, is like, can you do a couple of, cryotherapy sessions at, let's say, 3.5 minutes. So, that might get us to 7 minutes. And then can we do a couple of cold showers that are actually kind of dropping that temperature in a slightly different way, just to keep mixing it up and keep the body functioning well. I noticed this very dramatically, that during the winter, I use my pool as a cold plunge, and I'll jump in there a couple times a week and do 2 or 3 minutes in the morning. And then I'm still doing cryotherapy on top of that. So I'm probably surpassing that 11 minutes. And I noticed during the winter, I just feel dramatically better. My energy's better. My sleep is better. And, I like winter. There's a lot of things. I'm spending more time outside. I'm doing all these things, but is a big portion of that I am surpassing that 11-minute mark. And I think it is an important factor that we should consider whenever we're looking at these things. But so from an inflammatory standpoint, we see a ton of research that says, how much can we improve this response and reduce TNF alpha by doing cryotherapy? And it does appear you get to 2 to 3 times a week, you get to that 11 minutes of cold exposure, and you're going to decrease inflammation to a significant degree. Now, it depends on how much chronic inflammation has been there, on how long this takes to get you to, that normal state of systemic inflammation. But we know that it is an improving part of this. We can get into all of the benefits of changing diet and testing and doing all that stuff in conjunction with cryotherapy. But I think cryotherapy does stand on its own to improve the inflammatory markers in our body. Also, if we're looking at soft tissue repair, part of this feeds back into the inflammation. The less inflammation we have, the better our soft tissues are going to repair. That chronic inflammation really stresses those tissues on top of whatever caused it. So whatever tissue damage, we sprain an ankle, we pull a hamstring, a lot of those things we notice there's a tissue damage. Then there's inflammation that's good, that helps to heal. And then there's more inflammation where the body over responds and isn't able to clear out that excess. And doing cryotherapy certainly helps to kind of keep that level in a healthy range so that we're getting all the benefits of inflammation and healing, but we're not overdoing it and irritating the tissues. The other thing that happens during cryotherapy is that you'll actually get a down regulation of collagenase activity. And collagenase breaks down your collagen, which is like the building blocks of your tissues. And so this is where we see a very nice prevention aspect of it, is that in our athletes who are coming and doing our hero program. So during a football season right now, we have athletes that come and they're doing cryotherapy starting from the very beginning of the season. And the nice thing about that is that we're keeping all the collagen and inflammation healthy in their body, which prevents injuries later on. And so we get to this point where they are actually feeling better and going to have a less risk of injury come middle and late season, because the collagen fibers have weakened. They've got inflammation in areas that their body hasn't dealt with. And then we see these non-contact injuries throughout the season that could have been prevented had we improved those things. In an injury, we need collagen to repair it. So if somebody comes in and they're doing a regenerative therapy protocol and we're using collagen to actually build up the tissue health, we don't want the body actively breaking down that collagen in those moments. And so this part of the cryotherapy kind of benefit package is that we really do protect and help improve collagen strength throughout the body. And that can be helpful in a ton of ligaments, muscles, tendons. I think this is where we see a lot of our patients who add cryotherapy to their recovery protocol, especially if it's soft tissue, improve dramatically faster, up to 200 to 300% faster than their counterparts who don't add cryotherapy to their plan of care. And so, that's a big part of it, is do we have the right building blocks in the body to repair these things? So I think that is not something that should be overlooked. If we start to jump into pain, like what does cryotherapy do for pain? The reduction in inflammation is a big part of this, I think. It's unambiguously positive when you dig into the research on what does cryotherapy do for pain. They've done quite a few of these studies. In one randomized control trial on arthritis patients, they did 3 cryotherapy sessions a week for basically 1 week. They did 3 sessions and they wanted to see what happened to their pain. And they all experienced a significant reduction in pain. Some of the pain was likely due to the anti-inflammatory effects that they got. In that week, they crossed that 11-minute barrier. The other part I believe is happening is that we are really, really releasing a lot of these inflammatory markers that could cause problems throughout the body. And if we clear that up, the body has an easier job of addressing the pain-causing tissue, and that allows them to improve a lot of the healing response and a lot of the pain response that they're getting. So I think pain has been well proven that pain alone can be improved doing cryotherapy. Most of the benefits tap in about 2 to 3 times a week, and you'll find that with a lot of the long-term improvements in physical function is that it really has to get deep into the body. And so this is an additive treatment. So, we do it one time and it helps. We do it 3 times batched together, and each session piggybacks on the previous session, and it really does make a better response, a better improvement overall, as opposed to spacing them out. And the way we tell people to use that in the clinic is, if you're only going to do, let's say, 4 sessions a month, then you're probably better off doing those 4 sessions in a 2-week time frame and then taking 2 weeks off. And then the next month comes and you've got 2 weeks where you do your 4 sessions and then you take 2 weeks off. That seems to be better in the literature than doing it 1 time a week regularly. Now, I'd rather somebody do that than nothing, but if we're really trying to optimize this and we have the self-discipline to schedule this and stick to it over, a 6 or 12 month cycle, that appears to be a better response in how we can improve this. The next part that I want to go into is the immune function of cryotherapy. And I think this is the biggest one that people miss when they start talking about cryotherapy. So cryotherapy, we get all of these improvements in immune cells, like improvements in white blood cell counts. We see changes in cytotoxic T lymphocytes, natural killer T cells increase. And I know these are a bunch of big words, but these are all immune cells that can help our body to fight off any type of attack, whether that's physical, whether that's viral, bacterial, any of these things. And I think this explains why when people are doing regular cold exposure, they appear to get sick less, especially when we look back. These are hard studies to do outside of, okay, what's your cell count? What's your immune cell count? And then let's look at it in kind of these retrospective studies where all these people are doing cryotherapy, what actually happened in their life. And the immune function is so important to all parts of health and healing and aging. If we can keep our immune system functioning well, we're going to do better across all aspects of health and healing and aging. So to me, I love the pain and I love the accelerated healing that cryotherapy gives us, but the boost in immune function is far and away the best reason to be doing cryotherapy. You improve almost every aspect of your immune system's function by a dramatic amount. I mean, there's cases where it shows up to 50% improvements in these things, and that's a huge amount if you're talking about improving your immune system's function. So that's one that we don't hear a whole lot about, is why it's cold, I don't need to do cryotherapy. No, during the winter months where you get more of these infectious bacteria, viruses being spread around, that's when we should be doing it more, if you ask me. And throughout these last few years, we've noticed the people who were doing cryotherapy regularly handled every part of health and virus attacks better than anyone else. So I think it's something that we really want to spend a lot of time on, because the immune function is everything. Your immune system is your protection system. That's your army. It fights off these attacks. When you get an injury, immune cells go to help repair that. If we can keep our immune system healthy, you're going to do better every single time with anything. Okay. Soapbox stepped off. Let's talk about some fun stuff. So weight loss and metabolism. I had quite a few of you who reached out and said, I basically lose a pound every time I come do cryotherapy, and not that it is, if I do it 5 times a week, I'm losing 5 pounds, but the people who were weighing, from morning to morning, 24-hour period that they were doing cryotherapy, they noticed that they lost about a pound. And I thought that was really impressive. And I wanted to dig into exactly what's happening whenever we get into some of this stuff. So if we look at why that might be the case, what's happening with metabolism? When we get cold, we get something called cold thermogenesis. This is where our body increases metabolism to produce heat. It's trying to keep us alive. Remember, our body really only wants to do 2 things. It wants to keep us alive and it wants to procreate. Everything else, our body doesn't really care about how we feel about how it does those things. So sometimes we have to kind of trick the body into doing the right thing to get us feeling better. One type of cold thermogenesis is something called non-shivering thermogenesis, basically where your muscles are not contracting to produce heat. Your body's having to figure out how to produce heat from a cellular level. If we experience this, it increases something called UCP1, uncoupling protein 1. And this causes some reactions basically that can convert white adipose tissue into brown adipose tissue. And we'll spend a second talking about what brown adipose tissue is. White adipose tissue is the typical fat cells that you see if you've ever looked up kind of what fat looks like. It's white, it's fluffy, it's big. Brown adipose tissue is kind of the opposite of that. It's these small brown cells of adipose tissue. They're small, they consume and produce much more energy, and they have lots of benefits versus white adipose tissue that has lots of harm. So in people who have more brown adipose tissue, they're often around the neck, the lower back, or the highest density spots, but they are found kind of a little bit throughout the body. Brown adipose tissue in high levels really helps to keep us healthy and keep our metabolism and our body composition in a better state. And so I think that's a big part of it, that if we can increase our level of brown adipose tissue, we're going to look better and feel better and have a better metabolism overall compared to somebody who has less brown adipose tissue. So we know that getting cold increases your level of brown adipose tissue. If we do it enough and we increase brown adipose tissue, what does that do? So brown adipose brown adipose tissue decreases white adipose tissue, so that's one part of it. It improves the liver function and fatty acid oxidation, so it improves a lot of that. In the pancreas, it preserves beta cells and the amelioration of insulin secretion, so it really improves the pancreas's ability to do its job. And this is where we see a lot of people who have diabetes or prediabetes actually improve their response when they're doing cryotherapy, and it's because of the effects on the pancreas right here. And when we look at the heart, it actually improves fatty acid oxidation and cardioprotection. So it starts to create these protective responses in the body around the heart, around the pancreas, the liver, and throughout the whole central nervous system, so in the brain as well. And so this is an exciting thing that we are tapping into from a metabolic standpoint. If we can increase brown adipose tissue, it filters into all these other parts of our health, and it really can improve a lot of these different areas that control metabolism and that affect our body's ability to process foods. And so, you know, the production of bradykines, as they're called, is we get this cardioprotection in the heart. We get this preservation of beta cells in the pancreas, and we get fatty acid oxidation and, you know, presumably lower fatty liver responses, lower white adipose tissue, so you have more lipolysis and better glucose uptake. In the heart, you're looking at, you know, an inhibition of myostatin, so the increase in brown adipose tissue improves the health of the heart in general from that aspect. So this whole level of improvement in weight loss and metabolism, on the surface, when I first heard about this, I was like, that is so superficial. There's so many other reasons for us to do it other than just losing weight. And then you start to tap into what is happening in our ability to lose weight. It's not just that we're burning more calories trying to stay warm. We're getting a much deeper effect in the body that can lead to long-term health benefits. And that's an exciting part of this, that it's not superficial. It's not shrinking fat cells. It's not just burning a little more calories. It's actually creating a lot of improvements in the body. So this is one of the things I changed my mind about. Now I'm like, hey, look, if you want to do this for weight loss, I think it is a wonderful thing to add to a diet and exercise routine, because it can do a lot for metabolism and full systemic health, as you can tell. When we're looking at like the antioxidant effects of cryotherapy, I think there's a really big thing that we need to kind of discuss, and that's something called reactive oxygen species. The damage inside our cells, when our cells use oxygen for fuel, they create an exhaust, just like your car creates an exhaust when it uses gasoline for fuel. The exhaust in your body is called reactive oxygen species. And those get released, and as they accumulate, they contribute to DNA damage, cellular damage, and almost all parts of the aging process. And so if we can clear those out faster, we can clear out these pollutants throughout the body, we stay healthier. That's what an antioxidant is. You know, an antioxidant is the cleanup cells that run around our body and clear up the pollutants in there. So whenever we do cryotherapy and we are doing sessions, we see a significant increase in antioxidant enzyme systems in the body. So there's one called glutathione reductase that was studied in a group of people who did 20 sessions. And what they found was that glutathione reductase, which breaks down glutathione, which is your body's master antioxidant. Glutathione reductase breaks that down and sends it to action to make it go and start cleaning up all of the pollutants. It found that they doubled their activity of glutathione reductase. So they doubled the amount of kind of cleanup cells that were at work in the body. So cleaning up all these pollutants of reactive oxygen species. And so that is a huge part. We tell many, many patients, glutathione is one of the only things I never stop taking all year. I have other supplements that I go on and off of because of health benefits. now, after digging into this research, I think if you take glutathione, you should be doing cryotherapy or cold exposure to make that more effective. And that's just what the research tells us. If you're getting the glutathione in, you want it to be breaking down and going do its work. Now, I think this is why many of us need to take glutathione, because as we age, when they started studying this, our glutathione levels decrease about 10% a decade starting at age 20. And that's because we've lived longer. We have more reactive oxygen species. More of that glutathione needs to be going to work. And so the levels start to drop. Our body can't reproduce it at a rate fast enough. And we see that improves or speeds the aging process. And so we need to replace that using glutathione or a glutathione liposome or a component glutathione supplement. You can't take the actual molecule of glutathione. Your body will break it down. So the one I take has all of the molecules that make up glutathione, and your cells absorb that and increase the level by about 300%. Liposomal glutathione is great. There's other kind of suppository forms where you're getting straight in the blood. You can go and do IV drips of glutathione. All great ways of getting it in. As long as you have a good proven way of getting it in, you're going to improve your body's ability to fight off oxygen stress and cell damage. But we need that kind of cold exposure to put it to work. And so I think that's a really good way of maximizing the glutathione that you're taking. Another antioxidant enzyme called superoxide dismutase was increased in that same study by about 43%. So your glutathione reductase was almost doubled. Superoxide dismutase was increased by about 50%. Both of these massive antioxidant function is going to really help keep your DNA and your cells healthy. There was another study done where they did 10 sessions in 10 days. Let's do a blitz and really see what's happening. And they found a very similar improvement in superoxide dismutase, about 36%, and glutathione peroxidase, which is another way of measuring the reductase activity, was increased by about 70%. So a little bit less, but still amazing. I mean, still, a reproduced study showing significant improvements in your antioxidant function. Just for explanation purposes, superoxide dismutase is the enzyme in your mitochondria that helps clean up damage so that your mitochondrial cells can produce more energy. And I'm going to go on a little bit of an aside. I know this is all about answering questions about cryotherapy, but when we do cryotherapy, we often want people to pair it with infrared photobiomodulation, so red light and infrared light therapy. That's because when we increase the clean environment around the mitochondria with cryotherapy, and then we leave cryotherapy and we go into the infrared session, now infrared stimulates activity in mitochondria, so your mitochondria to produce more energy. So now that they're in a healthier environment after the cryotherapy session, they can produce much more energy, much more effective and efficiently. And so this creates a really nice health benefit. If we just need cellular energy like our athletes, then it's great. They're not dragging, they're not fatigued, they're not, midway through the season, baseball players' arms dragging because all those cells are just damaged and inflamed. Our mental focus is better because all of those cells are being protected. But in our patients who have a damage and they need to heal, that energy those mitochondrial cells produce goes straight towards healing. And I think that's a really big part of why we see so many people heal faster whenever they're doing that combination of cryotherapy, clean up the environment around the mitochondria, clean up all of the reactive oxygen species, and then give the mitochondria the stimulus and the food that it needs to produce more energy. It's a very powerful combination. So that's why we do that. I think people, will appreciate understanding. There's a very deep thought process of why we add different things to therapies in our office. That's one of the reasons. Yes, we geek out on all of these things, I promise you. And so, that's really what's happening from a detoxification and an antioxidant standpoint. I think it's a very big help for people to understand That's an important part of aging. I think that's where a lot of this comes from. That's an important part of cell health, is cleaning up these cells and cleaning up all of these reactive oxygen species, cleaning up these pollutants. And this is one of those situations where I think we need to pair the activity with the supplement for people to really get the best results. So I hope that helps. Performance is something we're talking about a lot right now. We have a lot of football players coming in. We've got football players who we've worked with in the NFL that are doing amazing. Shout out to Elijah Mitchell. He is doing a fantastic job with the 49ers. So if we look at performance, there's been a lot of studies that have been done on performance. And I think everything we've talked about to this point leads us into we're going to have better performance. If we have less inflammation in the body, in the muscles, in the tissues, in the tendons, we're going to perform better. If we have a better immune system and our body's not fighting anything off, we're going to perform better. If we are recovering faster, we're going to perform better. We're going to be able to kind of exercise more, practice more, do those things. So all of those things help. But when we look at what's actually happening, one part of the equation is the mitochondria. Can they produce the cells we need for performance and for energy? And if we really look at like endurance work versus resistance work, I think it does give us some answers. So endurance work, because we have an increase in mitochondria activity from an oxygen standpoint, that makes it a much more powerful treatment for endurance work. So, we get that big cleanup around mitochondria, and we also get this mitochondrial biogenesis where your body's trying to make more mitochondria. And when that happens, your body has more power generators. Remember from whatever it is, 7th grade science, mitochondria, the powerhouse of the cell. The more of these low power generators we have throughout our body, throughout our muscles, the more we can use oxygen for energy. And that really helps us when it comes to endurance. And so if you look at the research on aerobic activity and cryotherapy, everything is positive. Our endurance runners see an increase by about 20% when they are doing cryotherapy. So it's definitely one of the things, if we can, use oxygen better and then clean up the reactive oxygen species better, then we can get a better endurance performance and we can recover from that endurance performance faster. And so when we really dig into endurance, I think that's the one that has the biggest jump in performance-based response from cryotherapy. Strength has been an interesting one, though. So just in strength training, what they found was that people who did really, really heavy, like plyometric exercises, so they're doing like squat jumps and leg curls, showed improvements in performance up to 72 hours after a cryotherapy session. So their tissues are fresher. They can create more power and generate more energy in those moves after a cryotherapy session. This is why we want, our athletes, our power, our strength trainers to do cryotherapy actually before their performances, because we notice an increase in power production after they do cryotherapy. There has been some research about, does cryotherapy actually blunt a muscle growth response after we train? And if you really dig into all the research, what we find is that if you do cryotherapy right after you do a very strenuous kind of progressive overload strength training exercise, that you will blunt your body's production of growth hormone that is in response to the heat and inflammation and the swelling in the muscle. We want some of that. That is the good stress that we're talking about. That provides a lot of benefits for us. And so we don't want to blunt that right away. Now, a very easy way to fix this is to just wait an hour. When they study this, that it takes about an hour to get to its full potential and its full benefit of stimulating muscle growth. And if we do cryotherapy after that, then we actually notice some benefits to the recovery portion of it and our ability to repeat the strength training faster. And when our body's not having to deal with that stress and inflammation, it actually can go into the growth phase of building muscle tissue faster, and we get a better response from the training. there has been some research that Dr. Andrew Huberman has talked about where if we are cooling the blood off in the middle of a strength training program, we can do more strength training and get a bigger response in strength. And the way that I think about this, and this was like just cool water. So during a strength training, you would go and run cool water over your hands, over your neck, over your veins at the wrists there. And I really think it's something that can be incorporated by a lot of people pretty easily. There are these like cooling gloves and cooling sleeves. We have freeze sleeves around. I think that would be a really neat way to incorporate this if you're trying to go through a big strength and kind of growth phase. So the other thing is, could we cool the body off by doing cryotherapy before strength training, do all of the strength training work from a fresh muscle perspective and get all of that benefit, and then after actually, let that heat and let that kind of swelling in the muscle and that stress stimulate the growth response, and then the next day or a few hours later do a cryotherapy session so that we don't stay with that kind of inflammation in the tissue. So I think there's more to be done on strength, but it's a very interesting kind of area where people are looking at. Timing is very important with this, but it's very, very helpful in endurance runners for sure. And just overall performance improvement in athletes. Elite runners who did cryotherapy, an hour, 24 hours, or 48 hours before they did hill running sprints had 20% increase in speed and power up to 2 days later. So if you have a performance or you have a game coming up, 20% is not a small thing. This improvement in power and speed is a very big deal, especially when we get to high level athletes. So, you look at the, anti-inflammatory, you look at the cellular energy production, and that does translate into performance whenever they've studied these things. So to take a step back, that's a lot, I know, but I do want people to understand what's going on in their body when we say cryotherapy. I feel like it's been talked about in the media so much that I don't think we have a good handle on the science of what's happening in there. So we've covered a lot. One is when you get cold, your body goes through a response. Your body releases norepinephrine, releases cold shock proteins. Your body stimulates mitochondriogenesis. Your body stimulates an antioxidant effect and increases the breakdown of these antioxidant cells so that they can clean up around our body. This is a very important part of all the benefits of cryotherapy, is that we get this systemic response. Norepinephrine can go up a huge amount in terms of cryotherapy. They've had studies where it's going up double and triple, and it's a very important neurotransmitter and hormone. We need it for lots of function, but it has a very potent anti-inflammatory effect, and that stimulates a lot of changes in things like arthritis, in pain, in healing, and in immune function, as well as in mood and stress and depression. Another thing is that bouts of cold stress have been proven to change pain on a number of different levels, but if we do 11 minutes a week, we see significant reductions in overall pain, even from a progressive issue like arthritis. So that is a very helpful thing to know what we're looking at. We went through a ton of immune function and what it does to increase the immune cells, what it does to kind of keep the body from overusing all of its immune energy and actually use some of that immune function to fight off stressors, to fight off issues, to repair damage, and to keep us healthy and kind of slow the aging process down. So, very, very interesting whenever we look at it. Cryotherapy has some very unique aspects of metabolism, and what it can do for metabolism, I think, is really exciting, because we see these changes of white adipose tissue to brown adipose tissue. And we see the increase of brown adipose tissue activity, which leads to lower body fat percentages, leads to better heart health, brain health, liver, pancreas. all of the above, because we have this improvement in brown adipose tissue. And so, not to be overlooked is what it does for, metabolism and body composition, I think is a really big help. And for sports performance, it has shown significant benefits in power, speed, and endurance. Timing is something we should pay attention to. So I hope that helps. I hope that makes sense for everybody. Let me know if you like some of these, if that was too much science, if you have more questions about cryotherapy. I'd love to address, any of them and any concerns. When we look at who should not do cryotherapy, I think it's something we should talk about. Raynaud's syndrome is something where people have a hypersensitivity to cold. And in general, what we tell those people is if they're going to begin a cryotherapy regimen, they should do it very slowly. They should start very slowly, meaning like sometimes 30 seconds, 45 seconds, get acclimated and this might be weeks, but we've had quite a few patients who were able to overcome the sensitivity of Raynaud's syndrome by doing cryotherapy. And I think it's due to a lot of the benefits that we've talked about on here. Some of the mechanisms of Raynaud's are probably actually getting addressed by the cellular response of cryotherapy if we can take it slow enough, and we're doing it under supervision. We're not doing it in a gym. We're not doing it jumping in a cold plunge at our house. I think in those situations, we should really take our time and have a professional overlooking us. We look at children under the age of probably 12, based on body composition and body mass. That's something that the parent and the practitioner should have a very good discussion. Pregnant women, we definitely want to hold off on that. And anyone with uncontrolled high blood pressure, you're going to get vasoconstriction. And so in those situations, until we get the high blood pressure under control, we probably want to hold off on cryotherapy in those situations. But the benefits are immense. I think the cellular response and the activity inside your body from cryotherapy is very, very impressive for something that lasts 3.5 minutes or 11 minutes a week. I can't think of many things in our health that we can change so many systems by doing something for 11 minutes a week. It's just amazing. So I hope that helps. Remember, do that one thing to get a little bit healthier today. And if y'all have any questions, if you have any issues, we're always here to help. You can find us at derrickhines.com. And if it's for patient inquiries or any information like that, you can go to acadianapain.com, and we'll get you any help that we can, even if that's referring practitioners around the country. We have a lot of contacts. So I hope everybody stays healthy and happy. Have a great day, everybody.